Hi, this is Dr. Bob Dannenhoffer. I'm the public health officer for Douglas County here in Oregon, and we are going through a terrible time with COVID now. We are having the highest number of cases we've ever had. Several days over this last week, we've had over 120 cases in a single day. That really is a lot of cases. We know that a number of people have gotten positive test results and wonder what they should do. Now, in the past, when we had a lower number of cases, we were almost always able to call people within 1 day of their positive test. However, during this tough time, we've not been able to reach anyone for a couple of reasons. First, many of the positive tests that people are doing are home tests, and we never find out about those results, and so we would have no way to call you. Second, we get the information about those tests from the state system, and the state system is really overloaded with the number of tests, so sometimes we're not getting those results for a while. And then sometimes we just have trouble reaching people because you have a bad number or people aren't taking messages. So if we've not been able to reach you, let me tell you what we would tell you if we did reach you. So if you have a positive test for COVID, I'm really sorry to hear that. COVID really has been a terrible disease. The symptoms of COVID are very variable. There are some people, especially young people, who when they have COVID will have no symptoms at all. They may just have mild symptoms of runny nose and a cough. The typical symptoms, however, of COVID are going to be fever, cough. Some people have this weird loss of smell or taste. We don't understand what that's about, but it's very particular with COVID. Many people complain of fatigue or chest tightness. So some people have nausea, vomiting, or diarrhea. For most people, these symptoms are going to last for a few days to a few weeks, and then will gradually resolve. However, about a quarter or maybe a third of the people, depending upon your age, will have what we call long COVID. That is, they'll have some of these symptoms that go on for a longer period of time, sometimes up for months. And those will be things such as a loss of taste and smell, extreme fatigue, shortness of breath with exercise, or this chest tightness that people get. If you do have those symptoms that persist more than a month, you should see your doctor. You'll no longer be contagious after a month, so you can safely see your doctor. The other concern, the big concern, is that about 10 or 20% of the people, depending upon your age and underlying conditions, will have worsening of the disease. Now, this worsening of the disease does not usually happen in the first few days, but usually happens a week or so into the illness. So people start off with the fever and the cough and whatever, and then a week or so into the illness start getting much sicker with shortness of breath and difficulty breathing. This is a real warning sign because these are the people who wind up getting hospitalized, and unfortunately some of them die. So a few days to a week into the illness, if you're getting worse, that's a warning sign, and you should certainly call your doctor about that. If you are short of breath, we really want to be sure that you get medical attention because oxygen and the other things they can do for you in the hospital really can help. Now, the other thing that we're really worried about is we don't want you to spread this to anybody else. We know that people with COVID are typically contagious from about a day before they have symptoms to about 10 days after they have symptoms. So a day before your symptoms and about 10 days after your symptoms. Except for the rare person with a strong immune disorder, like they've got cancer, on chemotherapy, have untreated HIV infection. Those people can carry it up to 20 days, but for the overwhelming majority of people, you're contagious for a day before your symptoms and to 10 days after your symptoms. And during the time that you're contagious, you really don't want to be giving it to anybody else. And so what we'll ask you to do is to isolate. So isolation is the word for people who actually have the disease. We want them to stay away from people. Quarantine is the word we use if you've been exposed to the illness, don't have it yet, but been exposed to the illness. And again, we want you to stay away from people so that you're not going to give it to others. So if you're going to isolate or quarantine, it would mean a few things. And in our house, we've had to quarantine a few times. And what it means, if you can do it ideally, is the person who's isolating or quarantining should have their own room. If possible, they should have their own bathroom. If that's not possible, they should not be sharing the bathroom at the same time with someone else. If possible, somebody should deliver their meals to the door, leave, have them open the door, take the meals, and then clean the dishes later. They shouldn't leave the house really for any reason. If you do need to go to a doctor's appointment, please call the doctor's appointment beforehand, because most clinics will actually see you outside rather than having you come to clinic and give it to others. This disease is really contagious. We have seen cases where one person has given it to as many as 20 different people. And those people are not necessarily sicker or different than others, but there's some people who just spread it a lot. And so we don't want you to be one of those people. How long do you need to isolate? You should isolate for 10 days after the onset of symptoms. So shorter than that, there's a risk of giving it to others, and longer than that is not necessary. So 10 days after the onset, if your fever is down and you're starting to get better. If you're still having fever at 10 days, if your symptoms are still really bad at 10 days, you should isolate more than 10 days until both the fever is gone and your symptoms are improving. For many people, that could be as much as 2 weeks of isolation. And then what do you do for the people who wore contacts? So let's say you got the disease you got symptoms on a Wednesday and you'd gone to work on Tuesday because you had no symptoms. Those people on the day before are contacts, and we would ask that you call them, tell them that you have had COVID, and we would recommend that they quarantine. They may have questions, and if they do have questions, they should call our hotline at 541-464-6550. We would ask them to quarantine for 10 days also, and during that time they should stay home from work, they should stay home from school, and they should carefully monitor their symptoms for fever, cough, loss of smell or taste, and or diarrhea. I know this is just a short video, but I hope this will tell you much what you need to know if you have a positive test. If you have other questions, our hotline is open every day at 541-464-6550, and they can help you with other questions. There are some things you could do to help us before we call you. One of those is if you could have a list of who those contacts were, their names, their dates of birth if you have them, or ages, and a way to contact them, because we will try and contact those contacts to tell them what they should look out for. So we're going through a tough time here, but we will get through it, and we'll especially get through it if people follow the advice that I've just given you. Again, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. Thank you.